Greetings from the Pacific Northwest, Seattle, Washington. I'm very much looking forward to being present with all of you in the near future. In order to facilitate that, I've been asked to provide an introduction to create the focus for the upcoming content of the lecture. You may find the title a little strange at first. As soon as I explain it, I assure you, you will find it much more compelling. Let's take a look. Hitman versus healer. Now, the objective of the lecture is to figure out why we have problems in practice, and it's going to become very obvious that those problems are when we're on the hitman side, or when we feel like the hitman. Our goal has always been to be on the healing side. The other idea is to understand how we can use new technologies, use ways that we can find to implement some of the things that we've been trained to do and yet may be misperceived by the patient. So for instance, we already know there are many disruptive innovations that have come into the marketplace and how we can use those innovations to help us figure out how to provide treatment and also present treatment and even help diagnose patients is where this will be going. I'm going to use a beginning example that I think will typify the entire rest of the day's lecture. For instance, you already realize there is scanning technology that is capable of scanning the teeth. The current companies utilize this technology specifically for crown and bridge procedures. What if it was used as a metric to track the patient? What if it was used for every single patient that came into the practice? What if we can begin to get much more use the ways this technology is being provided for us so that we can also begin to realize how it could make sense for our practice? So for instance, how often does a patient come into the practice like this one that has worn front teeth? You say to the patient, Mr. Jones, you've worn your front teeth, you've lost about a third. It's a severe wear. And the patient looks at you like, you're the hitman. You say, I don't have any problems. They feel like you're trying to sell them dentistry. And instead, you have the proper intentions. You're just trying to prevent further destruction. You're trying to help them preserve their tooth structure and give them an opportunity to have their teeth outlive them. But they don't get it. What if you had a technology that would scan the teeth, allow that to be recorded, and you would be able to come back several years later and rescan the teeth? Once you were able to do that, you can actually have the computer show the patient the changes on the teeth. Now, the beauty of this is this could also be delegated. This could be an entry point in practice. Don't need to make impressions and store the casts. This would all be done and stored on the computer. And look at the difference in the metrics that we could create. Instead of saying, Mr. Jones, you've lost 30% or you have severe wear, we can actually give them a number. Mr. Jones, according to the computer, you've just lost 27% of your front teeth in the last 3 years. Who's the hitman now? The computer. What do I get to do? Be the healer. I want to spend my life on the healing side, not the perceptions. I'm on the hitman side. That's what this day is about. I look forward to seeing all of you in the near future.